Hello, everyone. Thank you for being here this evening. My name is Chelsea Oliver. I'm the Director of Marketing and Community Engagement here at the Jefferson. I'm going to keep my part really brief because I'm the speaker before the people you actually came to see. So if you haven't already, please help yourself to snacks, coffee, water, anything over there. If you need any help throughout the evening, time is hanging out in the back. We have some volunteers out in the lobby, and I will be around if you need someone. We will also have a Q&A at the end of the presentation, so please hold your questions for then. Please form them as a question when you ask, and please wait for a microphone to get to you so that everyone here and everyone on the live will be able to hear your question. I would love for you all to join us again. So we have plenty of events, about 3 more weeks within the spring term of events coming up. If you would like to check out a brochure, take one on your way out, or look on our website, jes.erie.org. Everything is listed there. We would be happy to sign you up for an event coming up. But today's event is extra special because it is a part of our Ramey Fellowship program. So part of my little speech here is to introduce Dr. Roth, who is a JES Scholar in Residence, but also the director of the Ramey Fellows Project. And as you will learn, Katie and Jacob went a little bit above and beyond, and it's always helpful to have great guidance and support and a mentor, and that's what we all have in Dr. Roth. So please give a warm Jefferson welcome.
Thank you, Chelsea. For those who don't know what the Ramey Fellows Program is, I think probably the most important thing the Jefferson Society does is sponsor the Jefferson Civic Leadership Academy. It's not as high profile as the Global Summit, and in some ways it's not even as high profile as the weekly and daily seasonal lectures. But the Civic Leadership Academy, I think we're now in our 12th or 13th year. It is a program that, just as it says, is designed to produce civic leaders. The typical academy participant is a 25 to 30 something young person who aspires to be a leader, and there's and I'm not going to name them all because when you start naming, then you forget to name someone, and the person who you forget the name's annoyed. But there are multiple Civic Leadership Academy graduates who are elected officials, who run not-for-profit agencies in Erie, who are on city and county council. And so the program is doing what we had always hoped it would do. The Ramey Fellows are a subset of that, and the Ramey Fellows program consists of 2 parts, and the least important part of that is a highly, and I emphasize, highly condensed mini seminar in leadership theory, if you will. But the most important part of it is each of the people who are Ramey Fellows, they do a piece of independent research on an issue that's either of particular interest to themselves or of importance in the local community, and ideally both, of interest to them and of importance in the local community. And on that wall, you'll see the picture of the 16 people who over the last 7 or 8 years have done Ramey Fellows. And we have with us, so I'm looking around the room, I don't think I'm going to miss anyone, Damali Donovan, who is over here to my right, did a Ramey Fellowship last year on youth homelessness, and Chelsea is a Ramey Fellow who did a program that I'm actually still going to turn into a podcast, Chelsea, on my American Tapestry program on the intersectionality of country music and politics. This year has been a particularly successful Ramey Fellow year, not because of anything I did, just because of the quality of the young people that are involved. Tonight's presentation is the 5th Ramey Fellow presentation this year. The first one was Sarah McCall, who is a librarian at the Blasco Library, did a thing on the loneliness crisis and using libraries as third spaces in which people can meet. She has an incredible idea for a program about human books that actually the Erie County Library is going to sponsor a pilot version of it, I think in Fairview at Lincoln Library sometime this summer. Kat DiVittorio did a program in Corey on creating a rural autism center For her, this was not an abstraction. She's the mother of 2 children on the autism spectrum, and so she's literally on a mission to create. She discovered, in looking for services for her children, that there are none in rural Erie. I mean, none. The closest would be Erie itself, which is 35 miles away from Corey, or you go to Pittsburgh. And so she has come up with an idea. She's actually already gotten her 501c3 status. She's building a board, and she's building a community board, and she's raising money. So I wouldn't bet against her. Allie Eagle did an all-day workshop on women's empowerment here, which was a first for us. Brad Thompson just did one on multi-generational leadership, and tonight we have a very important one. Jacob and Katie are going to talk about what they call hidden voices, the unheard struggles of students. There is, many people know it, but not enough people know it, and even the people who know it don't know it with the right amount of intensity, for in large part. There is a youth mental health crisis going on in the United States, an epidemic, actually, of mental health issues amongst young people. And that epidemic is not being addressed directly. What Katie and Jacob have done is they have been doing research into the escalating challenges confronting public schools in Erie County, particularly as those public schools grapple with mental health issues. I think some of their statistics, for those of you who may not know a lot about this, you'll find, if not shocking, at least surprising. They're going to examine the current state of youth mental health support, highlighting gaps in services and understanding. They're also going to look at the stressors. Although it's not their primary focus, they're going to look at the stressors affecting students that have caused this, such as academic pressure. I wrote a book note in January on a book that I think is arguably the most important book I've read in the last 5 years, Jonathan Haidt's The Anxious Generation, in which he goes to in great depth to analyzing the impact of social media, pointing out that in a simple observation, if you look at social iPhones, these were made common in 2012, 2013. Prior to that, the rate of youth mental health is kind of constant, and then it goes like that. Okay, it's correlation, not causation, but the data piles up. Something is going on, and it particularly affects young girls, much more so than young boys, although it does impact boys. In any event, their presentation aims to shed light on the importance of early intervention, the role of schools in mental health support, and the need for comprehensive, age-appropriate support. Katie is a graduate of Edinburgh University with a bachelor's in social work. She currently serves as the career specialist in the Erie County Independence Living Program, and she serves her community by sitting on her local school board, or are I allowed to say which one, or you'd rather not, Northeast School Board, Advisory Board for the Office of Children and Youth, and Community Access Media. She's a graduate of the 2023 Jefferson Civic Leadership Academy. Jacob is a double graduate of Gannon University with a degree in political science and a master's degree in public administration. He's currently director of the Center for Family Business at Penn State Behrend, and he is also a graduate of the 2023 Civic Leadership Academy. So Jacob and Katie, hold your questions. Afterwards, we'll do our traditional Q&A.
I'm short.
Thank you all for being here.
Yeah.
This means quite a lot to us. We were just talking about how beautiful a day it is outside, and so for you to choose to come in here and learn with us means quite a bit for the research we've been doing over the last year plus. Now, we want to start by talking about what this title means to our project and why we chose it. And Katie, why don't you tell everybody?
So this project was an easy pick for me. It was something that I've been working with youth since 2015. I've worked in residential. I've worked as a family-based mental health therapist. I've worked as an independent living case manager, now a career specialist. I have been working in the youth industry for a hot second. One of the things that I thought was most important that we were to focus on this year would be youth mental health. In fact, Jacob and I were the cohort for JCLA 2023. I brought up the idea for youth mental health to be the focus for 2024. It was picked. But before it was picked, Jacob and I knew that we wanted to talk about this. And we wanted to take a closer look at the intersection of school and youth mental health.
Katie and I have been friends for 3 or 4 years now, and through our friendship we have a really good research partnership.
We really do.
We really do. It's a surprising thing we found out. And Katie has a great habit of randomly calling me, and I've adopted that habit now to her, and she'll say, hey, did you see this? Did you hear about this? And I had not heard about some of the things we're going to talk about today, and it's one of the main reasons that we're here today. She calls me and says, did you know about this? Right up here. We have 10 students.
10 students
in-
across Pennsylvania.
Across Pennsylvania. Katie, why don't you hit the slide there and kind of bring up what stuck out to us and what drew me into this as well as Katie.
There it goes.
1 in 10 sixth graders in Pennsylvania has a plan to commit suicide. That's data from 2023. 10% of sixth graders in our state have an active plan about how they want to kill themselves. It's 11 and 12-year-olds.
When we say active plan, we mean like they have thought whether or not they will hang themselves, use pills, shoot themselves. They have it planned out, which was really strange to me because in sixth grade, I don't remember having those thoughts. I don't remember knowing that that was an option. But again, this is larger state data and not so much county data.
And I don't have a background in assisting with mental health, but when I was going through the Erie School District, I struggled with a lot of the things we're talking about: depression, anxiety, stress. There was a lot going on in my life. There was a lot going on at school. I don't think I necessarily had this thought, but the fact is, the data shows this is happening. And as we're going to show you through this presentation, that number may be a lot higher than we're reporting right now.
So the scope of our research, who's all involved, right? So we utilize the PAYS data, which is the Pennsylvania Youth Survey. And basically what this is I think once every 2 years?
2 years.
2 years, they take a survey that is in the public schools. Now, kids are able to opt out, kids might not be at school that day, but this is the best general snapshot we have for youth data because we cannot go and interview youth, right? So to keep as much privacy and everything that we could do, this is kind of the data set that we're working with. So in this research, it does encompass the 10 elementary schools, 3 middle schools, 2 high schools, and over 10,000 students in our local area.
And you may not know this, but Pennsylvania is in the top 10 of student populations in the nation. We're ranked 7th. So we have the 7th largest amount of public school students in the nation. When you look at our population, that approximately 10%, that includes all public schools in Erie County. That does not factor in private schools, private religious institutions, homeschooling. That data is just not available or is not of a scale to be useful to our research at this point. So we are focusing on that particular demographic, which there is a tremendous amount of information on.
40 years of it, in fact.
40 years, in fact.
Yeah, so the PAYS data started in 1989. And so we have 40 years of consistent data that has been collected. One of the things that we did want to kind of talk about is the fact that even though this data has been collected, it's been collected by the Office of Crime and Juvenile Delinquency. So the data isn't always shared as broadly as it should be across the board. We do want to acknowledge that there are a lot of agencies that are trying to tackle this problem, but for some reason it just feels like no one's really communicating. No one's sharing the data and no one's tackling the problem together.
And when our research paper is released, you can go through our bibliography and look at a lot of these resources that we're talking about. But we pulled from local, state, federal, and primary interviews that we worked with. So you'll see data from the CDC. You'll see it from the Department of Health. What you'll notice, and when we go through this data, is the issue that we're talking about, the challenges that schools are facing, the escalation and intervention. We've known about this issue for over 40 years. This is not new. As Dr. Roth mentioned in his introduction, youth mental health has been tracked, and there's been factors that have led to its increase and its decrease, and we're going to go through those throughout our presentation.
And in the presentation, we're not really hitting like the hardcore things like schizophrenia or bipolar disorder or anything like that. What we're really talking about is anxiety, depression, PTSD from transitions. So whether that's transition to a new school, transition to a new classroom, just transitions in general and how that affects the student. Is that it for this one?
Yep. So the methodology we looked at was a mix of secondary research and primary interviews. That at the end of our presentation, we're going to go through those interviews and how they kind of developed. So we looked at the existing framework. Like we said, there is data from the CDC on the national landscape. There are states reporting on this. You can look through and identify frameworks that states are using right now to tackle youth mental health that individual school districts are developing. And then when we went through our primary research, we identified on our next slide the goals of our research, and we tried to correlate these primary interviews to those goals so that we weren't just kind of interviewing whoever would say yes. We wanted to have these people speak to the experiences that are not coming through in that data. It's fantastic that we have this information, we have numbers, we have graphs, we have things we can put in a PowerPoint. What we can't put in a PowerPoint is the experience of students, teachers, educators, and policymakers and what it means on a daily basis for them to see this happen.
So some of the limitations on this data are the fact that it is literally just a snapshot of whoever was in school that day. So let's say we have a youth who is clinically depressed, missed that day, don't capture the data. Let's say you have a, I'm sorry, I'm moving away from the mic. And that there's no direct youth input, right? So whenever we say things on here like has a plan for suicide, does the youth really know and understand what that means, right? From the data, we are assuming that they do, and it is presented in a way that we feel like it is exactly what the data has shown. However, there is room to tighten it up.
And when you start to extrapolate from national data to the local data for Erie County, the other meaning behind our Hidden Voices title is that we're capturing a small percentage of what's happening in schools right now in Erie County. And the numbers you're going to see are shocking. We're very confident those numbers are a lot higher than are actually being reported if all students were taken into account in doing this particular survey. So the goals of our research, we broke it down into 4 primary ones. First of all, identify, are these issues as prevalent as we're thinking they are? You're going to see the answer to that is yes. Youth mental health as something that's been tracked, at least in Pennsylvania, for over the last 40 years. It's been tracking up and up and up. Some years more, some years a lower increase, but always an increase that we've been seeing across the board when it comes to county and state issues. The next part is informing resource allocation. We're very lucky in our state to have an administration that recognizes a lot of the personal issues we're dealing with every day. In a recent budget, Governor Shapiro's administration put forward $100 million for youth mental health support services in Pennsylvania. That's a fantastic win and an acknowledgement of the scale of the issue we're dealing with. However, how does $100 million get spread across 1.7 million students? When you start to do those numbers, that is not a lot of per pupil spending if it's across the board. Mm-hmm. So how do we make sure these dollars have the biggest effect possible in the school districts that need them the most?
And how do we utilize those resources appropriately so we have the biggest impact? Does it look like a SAP counselor? Does it look like a psychologist on staff? Does it look like services embedded in the school district? Those are all questions that are yet to be really at this point unknown and not really specified by the PA government to kind of tell us what we should be doing to better our scores.
And if you're going to go for resource allocation, you need to be able to track it. So our third goal was, how do we actually evaluate and track the impact of these programs? As we all know, we've heard this before, you can't just throw money at a problem. So how do you actually track the impact of what we're doing? Are there tools that need to be developed? Are there tools already in place that can help us track the impact of these programs and see, are they helping or are they not having an impact on youth mental health? Me and Katie are very happy to say there are tools right now that schools can be using to track youth mental health and determine if these dollars are being used to their best effect and if more is needed. And then finally, it's promoting collaboration. As we noted, this data is not just Pennsylvania. Pennsylvania is not the only state looking at this. However, the PAYS data that's being collected by the Crime and Juvenile Delinquency Board It's not connected to the CDC. It's not connected to other state agencies collecting this. It's not connected to the Pennsylvania Department of Health. It's not connected to school districts. So while this data is crazily important to understand and interpret, it's not informing how other agencies are coming together to support these issues. And when we get into our primary interviews, when we talk about policy, we're going to learn about kind of the private and public collaborations that could really be a game changer for how these dollars are spent.
All right, so let's take it from a big view and let's make it little. So we're going to start with our national landscape. So the first thing that we're going to point out is that 29% report overall poor mental health, 22 seriously consider suicide, and 10% attempt suicide. Now again, this is a national view. This isn't PA numbers, but that's our starting point.
And when you look at the national numbers, you can see this is not an isolated incident. All states are reporting increased numbers of youth mental health issues and struggles. This is not just Pennsylvania. This is not just isolated to high population versus low population. Go ahead.
And as we did collect our data and look at our information, you also see that it's kind of split up between a couple of lines, right? You have male, female, heterosexual, LGBTQ, which are the most popular lines to kind of draw to get an idea of what we're looking at. When it comes to regular gender, male and female, we see that females are reporting higher overall mental health, poor mental health, and 30 seriously consider suicide and 14% attempt suicide.
And when you break it down across sexual identity, again, when we look at heterosexual and LGBTQ+, we see, again, a drastic increase across the board. Male versus female, you're usually looking at about a double rate there. Mm-hmm. When you compare it across gender and sexual identity lines, we're seeing closer to a triple increase in a lot of these categories. Mm-hmm. What that shows us is that certain populations are in higher need of more specialized, appropriate care to age, to ethnicity, to region, to gender identity. It's great when you have a counselor in a school. It's better when you have specialized services that meet the population's need in that school. Everybody, whether you have a diagnosable mental condition or not, you're going to have a bad day. You're going to have a rough day. But when does having a rough day once in a while become chronic depression, overwhelming anxiety, stress that ages students far beyond 18 years old?
And I think it's important to point out that this is not PAYS data. This is CDC. So this is a separate source than the first source that we were talking about, to kind of just show that across the board, again, people are talking, but we're not really getting any motion.
So next, we wanted to look at federal and school efforts. So across the nation, we know this is an issue. It's been recognized. There's not a debate that this is an issue. But what comes down to it is, what is the federal government doing, which is one of the largest contributors to resources in schools in our nation, and what are schools doing? So we looked at spending on pupils by the U.S. Department of Education. That's not the total spent by the U.S. Department of Education every year, but of direct pupil spending of nearly $120 billion, $458 million is spent on youth mental health, which is 0.00035% of spending. Again, that is about 4 times as much as Pennsylvania is spending this year, and we're talking about 30 million students. That funding has to cover all of their mental health needs on a federal level. So while it's great that money is being spent, is it being spent enough? Is there more that is needed on a federal level?
So, and on the federal level, there are also conversations about schools. Should schools be taking on mental health? Should we be shoving all of the programs for our kids' needs into school? I mean, it obviously makes a lot of sense to do so because that's where they spend the majority of their time. That's where you're going to find them. They don't need transportation. Why not? But the question really is are we putting too much on our schools? Schools are already struggling to meet the mental health needs of our youth. And adding this on top of it, when is enough enough?
And schools recognize this as an issue. As we show up there, nationally, 48% of schools have some form of mental health services. What I can't tell you right now is what that means individually for schools. Does that mean they have an after-school program once a month where they talk about their feelings? Do they have a dedicated psychiatric staff? Did they do a poster campaign about how to recognize emotional stress, anxiety, depression, those kinds of things? Schools are trying, but there are barriers in the way that are escalating that challenge even further than if they had to handle it in a normal environment. Number one, go ahead, Katie.
And I was also going to say, we're not really having discussions about how to utilize the tools that are already in our tool belt to address mental health. So that's something that we're going to dig into a little deeper, but it's coming, guys. Get excited.
So number one is insufficient staff. Again, a nationally recognized issue. Not just that we don't have enough teachers, but when you don't have enough teachers or teachers are doing double duty, triple duty, going after school to run programs, support staff is being pulled out of their roles to be substitutes, to cover classes. What that means is that they cannot be a counselor in school if they're proctoring a test. If they have to substitute for a teacher that's sick that day, that's a whole day of mental health services that are not being provided to an entire school of people. Next, we have unstable funding. Again, something that is unfortunately very common for school districts across the nation. There is no consistent federal line item that says, here is the baseline of how we will fund all of our schools. It is determined on a congressional basis. Every 2, 4, and 6 years, that number changes, and it's a battle, both on local levels, state levels, and federal levels to make sure that funding continues. So while schools would like to have continuous mental health services, when it comes down to it, if it's a difference between making sure students get educated and test scores happen and we see results, mental health services are one of the first things to go among support staff.
And again, just to emphasize, there is no standard quo that has been set for mental health. So again, is it a poster campaign? Are you seeing the Are You Sad, Call This Number poster, or is there a SAP counselor? Are you going to a group after school to talk about our sad days, or are we investing in psychiatry help and diagnosing, which I don't even know if schools should be diagnosing kids, but that's kind of the line we're walking right now.
And that's not to say the federal government's doing nothing. They're trying, but when there is no guidance to states about here's how common definitions, right? We talk about stress, anxiety, depression. The Department of Education has no standard definition of what that means to students, so it's up to sometimes states, sometimes individual school districts and schools to determine how they want to define youth mental health and who qualifies for services. That's a little bit of an improvised, scattershot approach to an escalating issue we're seeing across the nation.
I was real confident with that click. All right, there we are. So a little bit more data. So now that we're done looking at the national view, we're going to bring it down to just Pennsylvania. So 66% of districts identifying student mental health as the top challenge, 4th consecutive year. So this is the 4th year in the row that the schools have said youth mental health is an issue. 71% are reporting difficulty hiring and retaining mental health staffs. Wages and burnout, right? I know that we don't pay aides what we should pay aides. They cover so much for our teachers. They help that student who, instead of disrupting the whole class, the aide can just take that youth and work with them one-to-one. We're having a teacher shortage. I know that, in our district, we struggle to find people who want to work our district in a public school setting. So I understand where this 71 is reporting on the wages and burnout. And as you had alluded to earlier, whenever a guidance counselor is being pulled to proctor a test or do something else, are they providing those mental health services that they're supposed to be providing? So really adequately staffing and paying our teachers and our aides, very important.
And this data comes from the Pennsylvania Association of Educators, which since 2018 has been sending out surveys. We captured a snapshot of youth mental health. This survey is very extensive, and you can look in our resources and sources to find that. They send this out to every school district and school in Pennsylvania, and they get about a 57% positive response rate of taking the survey. If any of you know anything about large survey instruments, getting almost 60% return on a survey, that's incredible. If you get 10, 15, 20%, you're pretty happy. The fact that schools are taking the time to en masse fill out this survey shows how they want this issue to be heard and how they are speaking with a collective voice of the issues that are being raised. Two more that we pulled, which are pretty insightful. One is since 2020, student emotional struggles have been the top instructional challenge for teachers in the room. As Katie said, if there's a student who is having an emotional disturbance issue in the classroom, if they ignore it, the rest of the class suffers and sometimes has poor educational outcomes. So they have to take time out of teaching to address that issue. If they have to do that, there's now 19 other students who are not getting taught. That student gets pulled out of the classroom. Now there's a whole day of instruction loss. Now there's 2-3 days trying to recover from something like that happened. And if a school doesn't have the appropriate resources to provide one-on-one assistance or general assistance, those issues can escalate. And you may have seen, in news articles, U.S. students are more unruly than they've ever been. Suspensions, behavioral things are all on the uptick. That's not because students are more insane, more irresponsible. It's because there's no support in schools to be able to address those issues when they occur. And we're going to talk when we get to our primary interviews with a teacher about how early intervention can really tackle these issues. So classroom balance, education versus support. Teachers are balancing on that day after day, and they have to make a decision. And then lastly, in Pennsylvania, 97% of respondents have some form of mental health programming for their students. That's incredible. That's almost twice the average across the nation. So Pennsylvania schools recognize this issue. They are trying to do something, but they're all trying it individually. There is not a collaboration between them. There is not a guiding hand from a higher authority to say, hey, here's best practices. Here's programs that we can work with, which means there's a recognition of that issues, but there's nobody to guide the conversation. There's nobody to say, hey, this school district here is doing a fantastic job. Let's edify those practices. Let's spread them to the other school districts. If you happen to go to a conference and talk to the teacher who came up with it, maybe you can take that back to your school district.
So, even smaller. Now we're going to start talking about Erie County. So, I think it's really important at this point because we've gone through a lot of sad, and we're talking about mental health, so let's be a little happy. The JCLA cohort for 2024 did a whole entire program on youth mental health, and they took a very large, broad look at it. So if you're really interested in this conversation, I suggest you guys go back and look at their research. And not only did they do research, Jacob, but they created a youth mental health toolkit. It's basically a guide that you can go in and say, hey, I'm having these issues, and it's going to spit out the resources that you need. It has been definitely very interesting playing around with it the last couple of days to look at what resources are there. But it's a resource guide for our community. So it's not national, it's not state, but it is for Erie County.
And that helps inform us that we know there's a problem in Erie County. There's also a problem with the fact that the generations that are going to come through this system and become the adults that are entering this broken system, they're entering a system already dealing with these issues, having entered from a broken school support system. Which brings us to the actual data from the PAYS survey for Erie County. So just to give you an idea of how this chart works here, Katie?
So as somebody who sits on a school board, normally I get to see these charts in a very positive light. Typically, our kids in our district are above average, which is what you're seeing here, right? So the black dots are the state average, and we are above average in everything, but this is not the chart we want to be above average in. So if you look down below, you'll see the categories in which we're talking. So you have the 3 years, right? So each color is a different year, and the black dot is the state average. And then down here are the things that we're tracking. So we're tracking self-harm, past month of mental health, depressed in the past year, depressed about life, depressed about self, and thoughts of self-failure. And as you can see, unfortunately, Erie County is above average.
Now, you can look at this data and say, okay, well, maybe that's just what happened in this period of time. The great thing about the PAYS data is you can go all the way back to when it was collected in 1989. You can go to the PAYS web tool. You can compare state to every one of our 67 counties. You can compare county to county, year to year. What you will find for Erie County is a continual increase since 1989 in all of these categories. And the PACE survey has expanded to include more categories. They have breakdowns among every way you could categorize students across this state. And it's another great tool, again, if you're interested in this subject and you want to kind of get some more of these statistics to help keep the conversation going, it's a great tool to look at. One of the things that's very striking here is when you look between 2019 and 2023, 2019 was before we had all of our COVID lockdowns, before schools radically changed for students overnight. So we saw an increase in a lot of these incidences here. Once schools reopened, schools at this particular juncture are pretty much back to normal. There's no real difference between 2019 and what we're seeing in school today with regular operations, besides a few things. So those rates went down, but they did not go below where they were in 2019. In fact, they remained identical or increased, which means that while COVID had an impact on it, COVID is not the source of this. COVID does not mean that we're having a youth mental health crisis. We're having a youth mental health crisis, and COVID happened within schools. That's what we're seeing here.
So another thing that we like to point out with this PACE data too is that we're just looking at the mental health edge of it, but it also collects data on drug use. And so Jacob and I originally theorized that, it's the drugs. Like the kids are taking drugs, and so they're reporting poor mental health, and that would, that's what's going on here. And that's not accurate. Actually, we've seen drug use go down across youth in Pennsylvania and in Erie County, and for some reason, mental health still continues to climb.
There's additional research to be done to build a stronger correlation between that, but with the fact that that use has gone down year over year for the last decade, while these have remained stable or increased, shows us that that is not a primary factor driving the crisis that we're dealing with right now. This brings us to me and Katie's favorite part of what we did. Doing research and building a paper, it was great. Building this presentation was fantastic. Katie and I had a fantastic opportunity to sit down with 4 individuals linked to those goals and those outcomes we were talking about and really dive down into that hidden voice.
And so first off, I want to say thank you to Community Access Media for giving us a space to do our podcasting. They're an amazing little resource for our community, and if you haven't had the opportunity to work with them, please seek them out. They are so helpful.
And I will say that with Community Access Media, they gave us all the support and resources we need to make this happen, to be able to, at the end of this, we have the podcast re-recorded. They're up on Spotify at the end of this presentation. There's a QR code and a search so you can find them. So we're going to give you a summary of those interviews. Highly encourage you to go in and listen to that 5-episode series. We did 4 primary interviews, and then Katie and I did a wrap-up episode where we kind of summarized our whole research and kind of the impact that we're seeing.
So unlike our data where we went large to small, we're going to go small to large with our interviews. So that brings us to our first person that we talked to, which is Chance. Chance is somebody who is inside the system. He is a youth. They grew up in this area, and they have struggled with mental health their entire life. It was an amazing, although very short interview. It's the shortest one that we did. I think that even though it was tiny, it was very mighty with what it came across with. Not only were they able to speak to being a youth with mental health, they were able to speak to brick and mortar versus cyber and the supports that they were able to receive. And we got our first kind of little peek into the stigma of what it's like to be a youth with mental health.
And Chance also showed us what happens when students fall through the cracks. When Chance was in a public school, they were in a rural area, so they were going to a smaller school than some of the ones we have in Erie proper. And what that kind of showed us was the divide that happens when we're talking about that resource allocation. A smaller school in a rural area, not as many students, the data doesn't reflect as much as what's going on. They're most likely not going to see as many dollars as some other schools, even though they may be facing proportionally a higher rate of mental health issues around what we're talking about. And what happened in this particular case is Chance's performance in school was affected by their mental health. They had issues that were directly affecting it. They were being bullied. They were being ostracized. There was a stigma about talking about youth mental health in their school, to the point where they felt they could not talk to a single person in their school because it would end up on TikTok. it would end up on Snapchat. And it's never been easier for people who don't like you to find you and tell you they don't like you.
And I think this conversation really kind of highlighted one of the things that I didn't have to deal with in school. I don't think you had to deal with in school, is the fact that when you used to leave school, the bullies were left at school, and if they didn't have your parents' landline, they couldn't bother you. So this is really like our first kind of look into what it is like to have 24-hour access to a student.
And the advent of technology also means we now have cyber schools. We have virtual schooling. Virtual schooling was the turning point for Chance and their struggle with mental health in schools. Virtual education provided them an opportunity for smaller instruction with group size. It provided them individual instruction, which enabled their instructor to say, hey, Chance, I see there's some issues going on with your schoolwork. Do you want to talk about it? I have some time. They were then able to talk to Chance. They were able to understand what was happening. They were able to talk to their administration and say, hey, this student is dealing with this, this, and this. I recommend we get them some services. They were able to connect with service providers through the virtual school. They were able to get the assistance they needed to persevere through these issues. And Katie and I are very lucky to know Chance and to very happily say they're an advocate. They are living their life to their fullest. And that is in big part thanks to the fact that they were able to take control of their mental health with the support of individualized, specialized services that got them out of the state they were in.
So another just shout out to Chance is they also run a mental health podcast called Mental Matters. So you can find it on Spotify, where him and his co-host talk about mental health resources in our area. It's pretty cool, so check it out.
So next, we're going a little bit smaller in the classroom.
Bigger.
Bigger, sorry.
Bigger.
Bigger.
Going the other way.
We're going the other way. We went a little bit bigger with, let's talk about the classroom. We've talked to a student, and we've seen some of the gaps that exist. Now, let's talk to a teacher and really understand what's happening when they have to tackle these challenges.
So Lauren is a preschool teacher in our area. She just graduated with her master's just recently. I think I saw it on Facebook. She is a teacher at a private school, and she actually won an award for best teacher in the town, I think. It was kind of cool. So basically, we're talking with Lauren about what she's seeing as they come into the classroom from their home. So, right, this is the first interaction that a teacher gets to have. It's the student's first journey. So again, we talk about mental health stigma. You know, in her classroom, there is a lot of social emotional learning because she believes that that is a great foundation to start their student career at. So you're going to see a feelings tent. You're going to see the belly breathing. You're going to see the mantras and the time for kids to just feel those big feelings and then come back to their schoolwork.
And Lauren is a preschool teacher. Now, it may seem a little obtuse. We're dealing with our data from 6th to 12th grade. But when we look at the early intervention aspect, the data shows that early intervention works in a number of categories, whether that be mental or physical health. So how does a teacher do early intervention in the classroom? Lauren does it through helping these preschoolers recognize their emotions, to be forthwith and say, hey, Miss Lauren, I'm not feeling well today. I feel this way. And providing them the space, the resources, and the recognition to be able to work through those issues. Katie mentioned a feelings tent.
Yes.
There's a feeling tent in the back, and when these preschoolers have big emotions, they go in the feelings tent. They do what they need to do to recognize that emotion, get it out, feel it through. And me and Katie both know people we've worked with for years who could use a feelings tent. I think some of us in this room some days could use a feelings tent where we could just sit down and go through that.
With pillows to scream into.
With pillows to scream into. And how great would that have been if you had that when you were first starting to feel these emotions and understand that it's fine. It's fine to feel these ways sometimes.
Yeah.
And that sometimes you need help with them.
And especially being so little. Now, another thing that was kind of discussed and that Jacob and I thought was very weird, I mean, and we only talked to one person, so this is their perspective, is the fact that mental health interventions aren't really taught to our upcoming teachers, right? They're not really anything that she wanted to learn about mental health, she had to go chase down She had to become interested. She had asked the teachers for the resources. So this isn't something that's being taught to our teachers, and then we expect them to come into the classroom day one and be like, all right, you're also in charge of monitoring mental health. So we're not even properly giving our teachers the toolkits that they need to be successful in their job.
Here's $100 million for youth mental health. You have no education or training in youth mental health. Figure out how to use that money. That doesn't seem like a great way to run a system. The other thing that Lauren really explored to us is that she has gone out of her way as a teacher, spending her own money to go to conferences, to go to professional development classes, to learn these techniques, which she says has great results in her classroom, has great results in the school, and she's been able to share anecdotally with other educators. But at this particular juncture, when you look at a lot of college and professional curriculums of what they teach upcoming educators, mental health awareness, training, social emotional learning is a very minor component, while schools are continually being pressured to have more and more mental health services both in and outside the classroom.
All right, so this brings our conversation a little wider, and we talked about resources inside the school with Kristen McQueenie. Kristen is an amazing resource. She just graduated in the last cohort, so hopefully a Ramey Fellow here soon. And she's just abundant. So in this conversation, we talked a lot about IEPs, 504 plans. So does everyone know it? No, probably not everyone knows what an IEP is. It's an individual education plan. So this is something that you get whenever you have a long-term disability. So whether that be dyslexia, ADHD, it can cover many different things. So whenever it impacts your education, you are then given an IEP. IEPs are long-term. They follow the student, and they have to be done by state regulation. So you have 30 days to get this done, 60 days to get that done, and the plan has to be in place by the end of the third month. So it comes with a lot of strings and attachments and things that feel very permanent, which leads to the stigma of whenever you hand a child an IEP, parents, supports are like, oh, well, you've basically branded my kid for the rest of their life.
And it's worth noting that when we talk about IEPs, these are for what are commonly referred to as learning disabilities. So we talk about ADHD, we talk about dyslexia, things like that. Mental health is not a definition that falls under use of IEPs, but they directly affect learning. We can all recognize that happens. 504s are shorter term ones, correct?
Yes. So 504s cover your shorter term kind of things. So that would be like if you broke your arm, and you need someone to take notes for you for the next however long it takes to heal. Or if you are diabetic, that covers medical as well. So if you are diabetic and you need a nurse, that'll be covered in a 504 plan. 504s are traditionally for physical and medical issues, where IEPs are for learning disabilities. It's kind of where the line is drawn.
And what Kristen really helped us understand is that with a little tweak and some guidance from state and federal organizations to define how IEPs and 504s could be used, students could readily access services that already exist in and outside of the schools today.
And I think one of the things that we talked a lot about was the utilization of a 504 because it doesn't have all of those strings attached to it, at least in our understanding. And the idea that a youth can be struggling with mental health and that can be very temporary, right? So maybe, you're going through a transition, you're a brand new student, you just hit the classroom. That's a transition, that's a stress. And if a child shows signs, then maybe we should implement a 504 to support them for the next 3 months until they're integrated.
Very common life experiences that we've all gone through. Somebody close to you dies, family member passes, your parents get divorced, you're involved in an accident. The physical aspect of that's all handled in the schools. The mental impact of what comes after that, if you're a football player and you break your leg and shatter your knee at 16 and they tell you, hey, you'll be able to walk again, you're never playing football again, this thing that you've built your whole life around for the last 16 years is gone, where's the support for after that? Where's the mental impact that comes from that? Where's dealing with grief, dealing with instability in the home? All of those could be handled with those two tools that are used in virtually every school in the United States if there was guidance that allowed schools to understand how to use them and allowed them to be free from the worry of liability and the scorn of parents.
So another thing that we talked about here is the ACE. So the ACE is an assessment that talks about adverse childhood experiences and something that could readily be used in schools as a resource to say, hey, this kid has a high ACE score. Should we be referring out to other services?
And ACEs looks at adverse childhood experiences like, have you had somebody close to you who's been recently incarcerated? Do you have food insecurity? Have you been a victim of violent crime recently? All of these things that, again, are recognized as indicators that can lead to poor mental health. ACEs are given infrequently, but if they were given on a quarterly basis, on a yearly basis, to all students like we give lice checks and eye tests, we would be able to track potentially how students' mental health is being affected. Not all students react the same way to adverse experiences, but if you were the victim of a violent crime and then maybe that violent crime was a family member who's now incarcerated, there's a pretty good chance you're dealing with some mental health struggles. And that can be tracked through this survey that already exists. It's used by psychiatrists when they take in new patients. These tools exist, they can be used, and they can make a real difference if guidance and support is given to teachers and schools on how to use them.
And the ACE can also help identify like food insecurity and things like that, which can be fixed with a food bank, which can be fixed with resources that are readily available in our community to help stabilize that child so that whenever they show up to school, they're ready to learn.
Now we go to our macro example here of policy and community with Dr. Tyler Titus. This interview was really important. We did this one at the end of all of our other ones because what we wanted to understand was, as somebody who interacts with policy, somebody who sat on school boards, on somebody who's made the decisions on what happens with student mental health in our area, what are they seeing? What do they think could happen and what is happening right now? And provide the link between that data and policy.
So one of the things that this conversation kind of really pinpointed was how much do we really pack into a school before we start addressing the larger issues that are causing that child not to show up ready? You know, if you didn't sleep last night, you're not going to show up ready for school. If you didn't eat last night, you're not going to show up ready for school. If you didn't have a ride to school, well, you're just not going to be there.
If your parents have to work at 6 a.m. every day and they have to get you up at 5:30, get you dressed, get your other siblings ready, and put you on a street corner to be picked up by a bus, that puts you at a disadvantage as the student who gets to sleep till 7:30, has the breakfast already ready for him, has a lunch packed, and gets driven straight to school when the bell rings. Those students are coming into the classroom 2 steps behind every other student who doesn't have those resources and availability. So one of the terms we use, and I'm going to skip a little bit ahead and we'll kind of go back because I'm already on this approach, is social infrastructure. The fact that public transportation, that's a direct impact on student mental health. Food insecurity, stable housing, crime rates, all of these have a direct impact on the challenges that we're seeing, particularly when you start to take in the role of poverty. When you look at the PAYS data and the state federal data, you'll see a correlation between lower income levels and higher rates of reported poor mental health, self-harm, and attempts of suicide. Poorer areas do not have the same access to infrastructure. Public transportation is less, access to the internet, medical services, mental health services. Everything you could think of is less accessible when you're in poverty than when you're not.
Mm-hmm. And so one of the things that we were really kind of struggling with this this topic was just how much do we really ask and put on the schools before, you know, it's just too much for the school system to handle.
And we've seen a great model with the community school system that exists in Erie. It's been a fantastic model showing how when public and private come together and form a collaboration, you can bring services directly into a school that doesn't impact the learning outcomes. When you put a dentist in a school, when you provide an eyeglass clinic, when you provide specialized services, when you have a staff member whose job is to hear when these issues are happening, identify it with the student and teacher, and find a non-invasive way to handle it, you see success. There's a lot of data that the community schools have put out that you can find that show the positive impact that a private and public collaboration can have, particularly when it comes to the distribution of funding and the stability of that funding.
So, conclusions and findings.
So what we're recognizing here is that this is a national issue, and it exists here in Erie County as well. It exists on a larger scale here in Erie County. We're seeing increasing rates year over year. They're not being impacted by COVID. They're not being impacted by drug use. They're being impacted by what is happening in our community. They're being impacted by poverty. They're being impacted by a lack of infrastructure. They're being impacted by a lack of recognition of what is needed and how it is needed to be deployed.
I think that covers it.
Absolutely.
So, now that we've talked about all of the doom and gloom and everything that is scary, let's talk about just the two things that we want you to take away from our conversation today. Just two. I know you guys sat here and listened to us talk for a long time. Just two things. We need to first rethink how we think about youth mental health. It's no longer an angsty teenager. It is no longer, oh, it's just hormones. It's no longer just, hey, you had a rough day. When these kind of problems persist, we really need to take a community approach on how we can help that youth stabilize out and become a happy and healthy individual.
And it's very easy for us to say, well, the simple answer is get rid of the whole system and rebuild a new one.
Don't do that.
Don't do
takes
that.
forever.
It takes decades for something like that to happen. There's institutional resistance. And what we see here, and we've recognized, is tools exist right now. If we start to reinforce and support the tools that exist now, we can start to reverse this trend. And then once we start to reverse that trend, then we can start to dive deeper. We can develop the individual programs. We can identify what funding is needed where and how do we want to deploy it. But until we start to use the resources we already have, we're just throwing additional money at schools with no guidance and no support on how to use that funding.
And what I also think is important to mention here is that, like Jacob said, just throwing the money isn't going to fix it. We need to find long, sustainable solutions to the issue that's going on.
And the second thing we'd like to bring up is changing how we think and how we talk about youth mental health. Just because you're a teenager does not mean you're supposed to feel this way. And recognizing that school in 2025 is a full-time job for students. They are there 6 to 8 hours per day. That's how long you're at your offices or out in the field. And a lot of students are leaving school after 6 to 8 hours, being up since 7 in the morning, and they're going to work. They're going to take care of their siblings. They're going to after-school activities. And they're getting time to do their homework 7, 8 p.m., and they're expected to perform at a high level. They're expected to be there every day. And if they don't, there are consequences. If you're depressed today and you can't get out of bed because it just feels like the world is bearing down on you, sorry, you're truant. You had a family member died and the grief is consuming you and your family is in shambles, you got to come to school. But if you have the flu, get a doctor's note. You're good. A recognition that mental health is just as important as physical health, and that mental health is not something that just positive mental health develops as you get older. If you have negative models around you that produce negative mental health results, you're going to have these increasing rates. So one of the things we'd like you to take away is that if there is somebody in your life who is a student right now, if you see something going on, talk with them. You don't have to be the person to solve their problem, but you could be the person that recognizes the issue they're dealing with, which could change their life by getting them connected to a resource that already exists.
And so I want to say one of the things that we did see over and over and over in these conversations was just talk. Just be there for that youth. Again, you don't have to solve their problems, but somebody actively listening and saying, hey, there might be a solution somewhere, makes a huge difference in their lives.
Absolutely.
So last but not least, what's going on in the Erie community, right? There are some really great things that are going on right now. The multicultural health evaluation system, or MEDS, has presented the Eclipse project that's now in pilot. This is an amazing little program that I hope proves its worth.
And also, Krista McQueenie is an important
Yes.
part of the Eclipse project.
Yes, Kristen McQueenie is a part of the Eclipse process. But what this basically is a curriculum on self-advocacy when it comes to mental health. And honestly, with a couple of tweaks, I think it could be implemented into the school system as a way to teach our kids the life skill of self-advocacy when it comes to yourself and how you're feeling.
And so if you see this project come up on your news feed, you see it in the paper, and there's an opportunity for you to voice your support for it, if you read it and like it, voice your support for it. You would be surprised how often a handful of voices turn a pilot project into a full-fledged permanent part of a system.
And then, again, as we have talked, the JCLA 2024 Cohorts Youth Mental Health Toolkit, which can be found on the JCLA's website, is also a great asset to our community and a tool that is in our belt that we should be utilizing to help our kids.
And lastly, we brought up our podcast, so it's live right now on Spotify. You can follow this QR code right now. You can also just search for the title of our presentation that we gave on there. You'll find all of the episodes that we talked about with our primary interviews, so you'll get the stuff that we're leaving out for the sake of time and brevity. But if you enjoyed this presentation and you want to learn more, listen to those podcasts, read our paper, fill in the connections that we can't make just because we don't have 5 hours to talk to you right now. And we'd also like to just thank some of the people here at the JES, Dr. Roth, Ben Spagan, Chelsea Oliver. They've been a tremendous help through us going through this process and helping us organize our research, keep it going, and keep motivated, as well as our primary interviewees. They provided us a perspective we would not have, and they were open, they were honest, they were transparent. I really can't say enough about listening to their interviews and listening to people being fully honest about what's happening in our system right now. And then finally, we've already said it, but we really want to bring it up again because they're also here right now. Community Access Media made this podcast project possible. Without their services, without their space, we would not have had a good quality as we had, and we may not have been able to interview these people as well.
So thank you to everybody, and this has been a great project, and we're really just thankful. So thanks.
Thank you.
All right, so now the Q&A.
And if you do have questions, there are microphones. Just somebody will pass it over to you.
So in the schools, are they going more for the individual rather than group sessions with the students?
Typically, again, it depends. A lot of the time, the emphasis is placed on individual services, mainly because that student is causing a disturbance in class for whatever reason. So they provide that individualized service. Some school districts, I know we looked at a couple models in California that have regular daily group sessions for students. But it's, again, whatever the school or the school district decide works best. I wish I could tell you that we had the silver answer to what works best for this, but I can tell you that research shows best practices, and really what schools are desperate for is even just a sheet that says, here's what works best for addressing student mental health issues.
Any other questions?
How are parents included in these activities, interventions, causes?
So that is actually a great question. And the truth is that at this moment, I really don't know. This is, like we've talked about, there's not like a lot of communication going on. In an ideal world, you know, the families would come in and everyone would sit down and make a plan together, right? To, you know, make sure that we're supporting.
If it's a crisis, if a student is in danger of harming themselves or somebody else, the parents are brought in immediately. When it comes to lower end issues, maybe they have attention deficit disorder, they're sleeping in class, they're causing a disturbance due to anger issues, parents are brought in based on a severity issue. If a student says, like, goes up to the teacher because they're stressed that day and says, hey, you know what, F you, I'm out of here, they get sent to the principal, they get sent to there, maybe they get detention, maybe the parent finds out about it. when we talked with Tyler Titus, he brought up some fantastic points about how parents are integral to this process. How parents, when they recognize that we're not stigmatizing your child, we're not saying there's something wrong with your child, we're saying they need assistance, and we have resources to do that. Again, I refer to the community schools model. They do a fantastic job of communicating this to the parents. But if your school doesn't have that, if it doesn't have enough staff, it doesn't have somebody trained in how to address this issue with parents, again, a mental health professional, you're kind of left at wondering, are your kid just sent home with a note that says, hey, they were very disrupted today, they were pretty bad, you need to ground them? For decades, that was the approach. There's something wrong with your kid, you need to raise them better. And now we're seeing that when you bring parents in, when you have community health fairs, which we just had one today here in Erie County, when you let them know what's going on, how it's going on, and what you can do to help, you see a lot more positive results.
So again, I guess to clarify, there's no standard across the board on how that's handled.
Curious how much of your data are before January 20 of this year?
The PAYS data that we primarily use is from 2023 because they administer the survey every 2 years. Right now, they're conducting the survey for 2024, 2025.
Then I wonder if you could maybe motivate a follow-up study in 1 or 2 years to gauge the impact of reduced federal funding and support. Thank you.
I would love for this to be a legacy program or a legacy research that we hand down to somebody else to just continue to track and follow.
So
I think that'd be a great idea.
A little behind the scenes, when me and Katie originally designed this project, we had a different end result for what came up. We were planning on creating a matrix that would take in all this disparate data sources, put it together, and provide a tracking tool for agencies and schools to use. What dissuaded us from doing that was the immensity of the amount of data that exists and the time we had to complete this project. To your point, that is definitely needed. That's part of the collaboration between these agencies. Who's looking at all this data, correlating it to the spending, and then saying, has spending worked or not? Yeah, I'd love to be able to report to you in a couple years what's been the effect of that money.
Do we have to come back?
How do you see this being implemented? So you have all these beautiful recommendations, but how would you get the word out about this? How would you implement this plan?
Well, one of the first ways is through our interviewees that we talked about. These individuals have the ability to go into these systems and start to work with them. That's why we talked with people at all different levels. And one of the biggest recommendations is right now with you in this room, you can go to your school board. You can go talk with the administration of your school, and you can say, I've heard about how IEPs and 504s can be used for mental health. Are we doing that in our school? You can show them the data that we're providing, the conversation that we're having, and you can ask them, what are you doing to help our students? What are you doing in this regard? And also, how can I help be an advocate for that? When you listen to our podcast, the last question we ask every one of these individuals is, how can you be an advocate and have your voice heard today, tomorrow, and in the future? And each one gave a different perspective. But like I said, a handful of voices at a school board meeting, 5 people in a row saying this is an issue, speaking with the same conviction, speaking from the same points. That's how change happens. If our school district recognizes this issue and everybody comes together and says, we want to see the tools already used, modified, and changed to make this work, it'll happen. Katie sits on a school board and she can tell you.
It does, but it's longer than that. He's like, it's going to change tomorrow. No, it's not. But I think another really big thing that we can really tackle as a larger group is really talking about this to the right people, right? So we need guidance from the state to say, hey, let's look into the idea of utilizing 504s for mental health. Let's just look into it. Yeah. And then allow the schools to trial and error and try to figure out what works best and then implement that across the board.
And part of our RIMI fellowship is that in September, we'll be going with other Ramey Fellows to Washington, D.C. to talk with think tanks, to talk with congressional officials, to talk with senators, to talk with policymakers, and make these same points to them about when they go on the floor and they're proposing legislations, when they're using the highest platform possible in our country to make change, that they understand this and this is in the back of their minds. So in September, me and Katie will be going and talking to them and saying exactly what we're saying to you today about how guidance is needed, support is needed, and funding is great, but you need a mechanism and practices to make that funding work.
What happens upon graduation?
That's where the 2024 class really took a great
They
look.
are a product of amazing, upstanding citizens. That's what happens.
I can tell you
Graduate.
anecdotally, as a student who dealt with mental health issues while I was in school. Outside of school, I dealt with poverty. I came from a very poor family. My father was a disabled veteran. My parents were divorced. And when you talked about mental health in my household, it was, you want counseling? That's a crutch. Buck up, get over it. So a lot of students who graduate, they're disaffected. They don't see the use of support. They don't see what's the purpose of talking about this. I was in school and tried to talk about it and it didn't happen. You have instances like Chance of students who recognize what's out there and try to affect change. But right now, students are graduating from a broken system, entering a broken system. That's where we're at right now. And what we're trying to advocate for is sooner in their education rather than after they graduate. Let's fix the system and show them how a functional system works so that when they graduate, they know what to look for, and they can also then be advocates for that change in fixing the wider system that adults have to interact with.
And so also with projects like the Eclipse project, right, we're teaching them self-advocacy. So when they walk into that doctor's office, they will know how to say, this is how I'm feeling, this is what I need. They will have an understanding of what supports are out there. They will know that, hey, if I'm facing food insecurity, I know there's a food bank and I know where that food bank is located and I know how to utilize it. So whenever you're talking about what does this do for the future generations that are graduating, it's showing them that there are supports out there and they can be successful.
The overall great picture is that we're not devoid of mental health services and mental health support systems. They exist. They just need our support. They need federal support, state support, and a changing of the conversation from there's something wrong with you to we all go through this, how can we help you?
Hi, I have a question. So I'm a teacher, so I deal with this kind of stuff every single day. I dealt with it today. But my question is, like, based on your data, have you noticed, like, certain age groups where mental health kind of was kind of striked up? And also, like, what are we noticing, like, younger kids starting to have more mental health issues?
Typically high school.
Yeah, so typically in high school, but
Yep.
strangely enough, it was like the 11th grade year for some reason. Like in 11th grade, stuff went sideways. I don't know what's going sideways,
Yeah.
but it's like, it was weird because it's not where you would think it would be. You would think it would be like at graduation where we're going to have this big change or we're not sure what we're going to do with our life. Or you would think it would be in 9th grade whenever we got, you know, a whole brand new school and all the private school kids are now in with the public school kids and everything is weird. Or you would think it would be middle school, but no, for some reason.
Anecdotally, typically around that junior year, that's when more kids are getting jobs. That's when there's more responsibility. When you're 16, 17, the world opens up to you a lot more than when you're 15. So there's more responsibilities. Jobs come into it. It's a lot harder to maintain close friendships. School gets a lot more intense. You have to take final exams. You have to be thinking about college. You can find research on that. We didn't dive too deeply into that particular category, just for the sake of time. To your question of, are there age groups, is it happening younger and younger? Yes. When you look at that data, we brought up at the start of here how 10% of sixth graders in Pennsylvania have a plan to commit suicide. That number was not 10% 20 years ago. So we are seeing younger and younger populations. It's hard to administer large survey instruments once you get below that sixth grade level because the complexity of the questions have to come down, the relevancy of the data comes down. But if you've gotten to sixth grade and you're thinking of a plan to commit suicide, it's a pretty good chance that before that point, there are poor mental health outcomes that have led to that.
Thank you.
So, funny enough, I was just reading about this morning. I read that suicide was the second leading cause of death among children aged 10 to 14. That was from the CDC. But I guess my question is, I struggled to understand what has to go on in the mind of a child, let's say 12 years old, to get them to the point where they want to take their own life.
Katie can handle this a lot more in talking about how it's nice to imagine that childhood is always great. It's a great time and that bad things don't happen to children.
Yeah, so in my line of work, I deal with kids who have very high ACE scores, which means that they have been through either the foster care system, they've been through juvenile delinquency, they have been through a lot. And one of the things that's always hard to get people to understand is that even though this 17-year-old is standing in front of you, they are not 17. They have been through so much, and they are behind the 8 ball by like 10 paces. So when we're talking about like what leads to young people committing suicide, I would like to harken back to Tyler's conversation about the larger societal things that are going on. We're talking about food insecurity. We're talking about siblings raising siblings. We're talking about parents who are addicted to drugs. And you as a 7-year-old having to figure out, okay, I got to get home at this time. Mom's going to pass out from the drug overdose at this time. Susie's got to get a bath. I got to get this. Oh, and by the way, I have a spelling test on Friday. Like, we have put a lot of pressure on our younger generations, especially those ones who are living this life that is hidden from society because it's something we don't like to talk about.
And especially around things like violent crime and sexual crime. Again, that happens to children at a very young age. And when that is not recognized, support given to it, we have great resources in our area like the Crime Victim Center, which provides resources to children and adults who have been the victims of crime. But if you come from a household where that's not recognized and you're not connected with those resources, and you were sexually assaulted at 4, you were a victim of a violent crime at 6, and then congratulations, you're in kindergarten, how do you talk about that as a 6-year-old? How do you process that? A lot of them can't unless they get specialized services to be able to do that. That's not every child who, every 6th grader who goes through that process, but that can give you a little bit of picture of why somebody by that age is thinking why they want to commit suicide. What I'll end on, oh, we have some more questions. Perfect. I was going to say I'm going to have a positive note if there was no more questions.
So we'll take it a little lighter. So what can you recommend for families to do at home to help with mental health? Because, the kids are at school, maybe they come home, there's kids with good families, and they're still debating suicide, and they may even attempt to commit suicide. And, you see a lot of the parents turn around going, wow, I never saw this coming. I had no clue it was going on. And, so to take some of the pressure off the schools, what can you recommend for parents to do at home?
So one of the biggest things that you can do is talk. One of the things that we kind of discussed even before we started this was Jacob kept on using the term exit when it came to suicide. He was like, oh, they are choosing to exit. And I think one of the biggest things that you can do is you can talk about suicide. You can, mentioning suicide does not increase their want to do it. I can't tell you how many real conversations I've had with youth where I've had to say, okay, is suicide on the table? Like, are we really talking about a severe harm to self? Or are you just saying, I'm so frustrated that I feel like this is the only thing I have? I've sat through a lot of crisis intervention. I've sat through a lot of, holding hands while we try to figure out whether or not we're going to kill ourselves. And the biggest thing that you can do as a support for that young person is to talk and to ask directly.
And to find out how they want to be talked to. I have a 10-year-old. When I pick him up from school and we're walking side by side and I say, how was your day? He goes, fine. But as soon as he gets in the back seat of my car, we go for a nice long drive, opens up about his whole day, everything that's happened. So it's not necessarily every time sit down, have that direct, honest, frank conversation. Be an open person in a student's life. Be a person that they feel comfortable talking around, and find the avenues how they feel comfortable talking. My fiance is in the audience, and she could tell you quite a bit. I have some of the best conversations with her when we're driving, and I'm focused on the road and talking. It frees up my mind, and I'm able to process things in my life and go through issues. There's not one way to solve it, but by being open, honest, and communicating with these students and recognizing the issue as serious to them, that is a tremendous way to make an impact in their life.
I am a teacher in the public school district, and I actually teach in Erie Public Schools. I teach at Jefferson Elementary School.
Thank you,
And,
thank you.
Thank you. I'm first grade teacher. It's my 25th year. But we are a community school. We do provide breakfast for our students every morning when they walk through. It's a free breakfast. We encourage them to take a breakfast every morning because that encourages them to have that great start to the day. We work them through the day, and we also have a behavior specialist. We have a mental health specialist as well at school, which is nice because it's nice to have them there to help the teacher to say, what can we do? How can we help this student? We have a SAT program to also help the students, a student assistance program that meets every Wednesday to discuss students that teachers feel need that little extra help, and we find a way to help them. So I feel the community school is a great avenue for these students because it really can help them. Thank you.
Thank you so much for speaking to that.
When we were going through our 2023 cohort, we had a presentation from the United Way on the Community Schools Foundation. It was really eye-opening to see something like dental work, right? The student has a cavity, their parents don't have insurance, or maybe they're not in their life intensive enough to take them to the dentist. They're suffering with severe dental pain. Maybe that's why they're cranky at school. Maybe that's why they're stressed and depressed. And then that gets taken care of, that student is turned around. They need eyeglasses, right? It's not that they don't want to read and they're combative, they can't. And they don't know how to express to you that they need optical care. So you're exactly right in that not everything revolves around making sure every student has a psychiatric specialist to help them. Some of this mental health outcome is because of factors that are outside of that child's control. A 14-year-old cannot go sign up for insurance and go see a doctor whenever they want, right? A 14-year-old, if they have working papers from their parents, they could produce an income. They're not going to make an income to get their own apartment, get their own food, get medical insurance, do all of this. And so when we're talking about that open and honest communication, sometimes it might be a student that says, hey, I'm depressed because I go to bed hungry every night. I have one meal a day, and it really bums me out that I have to see my siblings go to hungry every single night, and that's really a factor in my life. Food insecurity, you solve something like that, you may have turned around something that could have been a lifelong battle with depression and anxiety into a passing phase of life. That was a much more positive note.
Yeah, it's way better. Glad we ended there.
We have to remember that for the next time we do a presentation.
Did we end there?
Could we give them another hand?
Thank you.
Thank you.
No further questions? Actually, I have a question.
Oh, boy.
I have a couple observations and a question, because one, I'd like to compliment you. It's as excellent a presentation as I expected. And they've been working on this for over a year. The question is, well, the observation is, and it came up late, a question from the audience, this isn't a school problem.
No.
This is a societal problem that lands in school because that's where kids go. It may turn out that schools are the only way to fix it, though. The question in the back was very pertinent. What's going on in our politics today, you noticed, I forget the exact number, but it was several billion, it was a couple of $100 billion come from the Federal Department of Education, which is in the process of being abolished, and its budget canceled out. So that money will go away. So this is a question, and this might lead to an opportunity if you're interested. In Erie County, there is no countywide school board. You have, in effect, the city of Erie, the Catholic school system, which is a system, and then you have, for lack of a better phrase, the private Christian schools, but they're not a system. They're all, and then you have, I forget the exact number, I used to know this stuff because of my other life, but there's something like 17 high schools or 17 school districts in Erie County. Who speaks for them? If the federal government is going away, the state of Pennsylvania, but the state can only do so much because there's some, what is it, there's some absurd number of counties in Pennsylvania. It's not 88, that's Ohio has 88
67
counties,
in
but
PA.
Pennsylvania has a big number of counties. So who would you convene if you wanted to have a conversation about what schools can do? Because I agree with something Katie said. This is probably not what schools were designed to do. And sometimes when you deal with older generations, they don't get that because they remember school as a very different thing than it is now. But it's landed in school's lap. So how could we, this is the opportunity, you said you wanted a legacy. We have a lot of good Ramey programs that are no longer one-offs. Let's figure out a way to use the Jefferson as a convener, and who would we invite?
I think there's 2 points. One, Katie, we were talking about what we want to do next. Right, we were talking about that on Monday.
We were just talking about next
and it was
projects.
Katie's idea of a legacy that I've gotten drawn into. Two, I think it's pertinent that we're having this conversation in the Jefferson, based around Jeffersonian ideals of community, of self-sufficiency, of when the wider government won't provide, communities have two options. They either make do or they find ways to do better. Again, what we're seeing when we talk about schools in particular, the community school model, we're seeing philanthropic organizations like the Erie Community Foundation taking up the reign of those federal dollars leaving and finding ways to fill the gaps so that we can use local money to solve local issues, community money to solve community issues. So who would I convene? First of all, people much more well-versed in a lot of the issues we talked about than myself. I would definitely say bringing in educators, veteran educators in the system right now as a component. That would be my number one suggestion as a part of that board.
Yeah.
And then
I wasn't expecting you to answer. I didn't mean to, I'm not putting you on the spot. I think what we should talk about is what we do next. But I like what you were saying, because what Jacob was just pointing out is, for better or worse, what has to happen. Some years ago, we brought a guy in here on economic development, Bruce Katz. Some of the people in the audience have probably heard him or even read his book, The New Localism, because he was saying then, 10 years ago, actually it's probably even longer, the federal government isn't going to come to save you. You're going to have to figure out how to save Erie, and actually there are people, because we do happen to have the benefit of some people who understand corporate responsibility, willing to get involved. They're trying to save the city. Save's probably the wrong verb, but they're put together public-private things. And I think this is what you have to do, because this is an immense problem. One of the things I thought about early on, I'm going to really stop talking about it, is just the first couple of slides, and I realize now from the questions it's preaching to the audience, but statistics can kind of be numbing. When you say 41%, a lot of people have a hard time wrapping their head around that. 41% of teenage girls have mental health problems. Well, that would mean in any group of 10, 4. Or in any group of 5, drawn at random, 2. 22% of all youth, more or less what you're talking about here, is from like 10 to 20.
Yeah, and
22% would be in any group of 5, 1. So I guess I know I'm talking to the choir because of the questions you asked. This is an immense problem.
I would end with this, really. If you have to do with what you have and you want to do better, your unofficial responsibilities we all have as citizens of this region is to hold the people who have power, who have accountability to money, who have funds, to hold them to task and be vocal with them. Sending emails and letters is a fantastic way, but I can tell you, having just spent 2 days in DC talking with congressional members about family businesses and their impact, when you're in their face, when you're talking with a staff member, when you are giving a personal story that connects to an issue going on, they cannot ignore you. And so if you have these opportunities to speak to your school boards, to speak to your elected representatives, to speak to people who have the ability to influence these programs, whether they be student mental health, fixing things in schools, whatever issue is important to you, take advantage of that because they are few and fleeting, and you can make an impact that lasts quite a long time.
Well, I'd like to thank Katie and Jacob again. It's outstanding, and we'll have to try to figure out how to go to the next step. Okay, thank you for coming.